Hi there, I'm Lily. Welcome to the Vital Horse podcast. I'm a veterinary surgeon passionate about what our animals' behaviour can alert us to. I focus on nurturing the innate nature of animals to address the deep roots of health, well-being and vitality. Our relationship with our horses is an inextricable part of this. I am guided by what they show me. Many people say, if only they could talk, but they can tell us so much and we can communicate back. This podcast is about you being able to help your horse fully by finding out what's going on, deciding how best to help, and then doing this ethically and effectively. In this way, we can investigate and treat behavioural signs and underlying health problems, pain, or dysfunction in our horses while actually improving our relationship with them. Let's find out how. In this episode, I consider the question, have we really ruled out pain? This is quite a common question for clients to come to me with for my online consultations and in-person visits or boarding rehabilitation cases at my own track system facility. Horses often show behaviours that could be attributed to underlying pain and discomfort, and often conscientious owners will seek a veterinary investigation to make sure that there isn't underlying pain and discomfort there before implementing some kind of training plan. That's a common pattern for people to follow. And there can be a few different outcomes of that. And sometimes we don't find much, or the diagnostic test results are confusing or inconclusive. And sometimes people are left wondering, have we really ruled out pain, or have we just not found something? So that's what I will consider in this episode. Hi there, welcome to this podcast episode. So the topic of this is, have we really ruled out pain? Now, this is a really important part of any vet, actually. I was going to say an equine vet, but it's a really important part of any vet's work, is when an owner comes to us and their animal is showing a behaviour that could be indicative of an underlying health problem, including pain or discomfort, that we can work towards answering this question: are they in pain or not? Is there a different reason for their behaviour? Now, at least when I was at vet school, we weren't really taught how to investigate behaviour. And in horses, it's not really exactly the same thing as a lameness workup, but it's quite common for that same process to be followed. There's a bit of a debate about the definition of pain and discomfort or unsoundness in horses. And so there's a bit of a debate that can be had about lame versus unsound and lame versus asymmetrical, those kinds of things. What does quite a subtle asymmetry or movement abnormality mean in terms of underlying discomfort? And we could debate that ongoing forever, probably. And there's lots of really valuable research that goes into trying to answer that question. In terms of practically helping our patients, the question that I like to pose is, what is behaviour? And really what it is it's an expression of internal state, and it's influenced by all of their history, so it's influenced by the past, and that culminates in their current state, whether you mean physical, mental or emotional. So physical state, the state of their physiology and the structure of their body, so the structure and function of their body, combined with things like their learning history, so what they know, what they understand, and their emotions, so past emotional states, and it could include bodily held traumas and things like that, and current emotional state. And all of that culminates to express itself as the horse's behaviour in any moment. what is pain? So, the International Association for the Study of Pain's most recent definition of pain is that pain is an unpleasant sensory and emotional experience associated with, or resembling that associated with, actual or potential tissue damage. If you've taken any of my online course offerings, you probably would have heard me talking through this before. I'm just going to dissect this down because it's really helpful for answering the question, have we really ruled out pain? So the first part of it is that it is an unpleasant sensory and emotional experience. So the emotional part of that is really important. Pain is not just some nerve fibers firing. There's also an emotional aspect to it, and there is a perception aspect to it. And that is, of course, influenced by all sorts of things, including a horse's past experiences, their history, their learning history, and also their kind of personality. And that can change. Pain thresholds is kind of a term that is used, and I guess I will use it because it's in common usage, although I would say that it might not be as linear as a phenomenon as a threshold would be, but it's a useful way of thinking through things, I suppose. So horses can cope, different individuals can cope with different types or degrees or instances or contexts of unpleasant experiences. I'm sure that you will know of horses that feel more discomfort around discomfort than other horses do. They seem to get worried by being worried, and pain might be more aversive, or certain types of pain might be more aversive for certain individuals, and that can help to explain different behavioural responses. The next part of the definition is that this unpleasant sensory and emotional experience is associated with, or resembling that associated with, actual or potential tissue damage. So there's a lot of ors in here and associated withs, but really what it means is you don't have to have actual tissue damage to be experiencing pain. You can have potential tissue damage, so you can have the threat of tissue damage, and you can have just something resembling that. I will talk about thresholds. So much as I think that it's quite complex and not very linear, the concept of a threshold is quite a helpful thought framework, because we can think about a threshold as in a step that something has to get over in order to be experienced. So say that's pain. You might have several things that stack up in order to reach the level, the height of that step. And in different individuals, the height of that step is different. And in different individuals, the number of things that are stacked up in order to reach the height of that step is different. So there will usually be several things stacked up in order to reach that threshold, and they will be sensory and emotional, or they can be one or the other. So you could have tissue damage that shows up on a diagnostic test. So usually that would be imaging, or it might be a physical examination. So a lesion is an abnormality of the body that you can see, and you can either see it with the naked eye, for example, a wound, or you could see it on an X-ray, for example, osteoarthritic changes in a joint, or you might see it under the microscope, for example, an inflammatory response in a tissue. Bringing in the emotional experience part, and if a horse has a high level of stress or fear, some sort of unpleasant emotional state like that, it might be that they don't need as much of the sensory input in order to tip over into a pain response. It might be that if we help them with their emotional experience, their pain can be alleviated. I'm not saying that we don't also use things like pain medications, and I'm certainly not saying that we don't treat any diagnoses that we do find. But what I'm saying is that in different individuals, there will be different factors contributing to how they feel about the presence of either pathology or sometimes something that we can't actually find on diagnostic imaging and tests. So what might that be? Something that we can't find on diagnostic imaging and tests. One thing that's quite difficult to find on imaging is something like a nerve impingement. So a nerve is being squeezed. There might be some secondary evidence if we were to do some imaging of a bony spur somewhere where a nerve exits, where there's a nerve channel, for example, and then you could have a pretty good idea. It's like a smoking gun, adding weight to that theory. But it's very difficult to actually image a pinched nerve, for example. What's something that you could easily see on a diagnostic test is something like a fracture or a tendon tear, for example, on an ultrasound scan. So those things you can actually see, or maybe if it's inside the foot on an MRI, for example. There is a phenomenon called central sensitization of pain, which is where the pain highways that go to the central nervous system and allow the individual to perceive the experience of pain get heightened. So they get more sensitized. And it can even be that once that's happened, something that would normally be mildly painful becomes really quite painful, or something that would normally be non-painful becomes painful. So then you can get little things contributing to greater pain than you would otherwise expect, maybe from their diagnostic test results. And the central sensitization can happen for various reasons. It can happen because of underlying disease processes that are going on, usually if they have grumbling pain somewhere, or if you have multiple injuries and so there's a stacking effect and the nervous system gets sensitized. There is also a part to play here with emotional state and central sensitization. As an example, if you were to do a gastroscope on a horse and find quite mild gastric ulcers, but they seem to have an explosive response to being girthed, and it didn't seem to make sense, there could be central sensitization going on. And I wouldn't say to link the severity of the lesions on imaging to the severity of their signs. I think that they can tell you how painful they are actually feeling, and you can believe them. And if you find things on diagnostic imaging, then they are all adding to the evidence. I don't think that they should be discounted. The absence of lesions does not mean the absence of pain if you go through diagnostic tests. And if your horse is telling you that they can't do something or they're finding something unpleasant, then I think that that answers the question in that moment. We haven't ruled out pain. It might not be pain, but we can't say that it's not for now because they are telling us very clearly that they're uncomfortable with something happening. One thing that I would say at this point is that riding horses is actually a very tall order. There's all sorts of language surrounding the use of horses, like doing their job, their ridden career, and referring to horses as a genuine sort if they are obedient to be ridden, for example. I would counter this by saying that all horses are genuine and you can believe them. If they're telling you something, you can believe them that that is their experience in that moment. And let's not get our horses caught up in any sort of work ethic of our Western capitalist society where your productivity is what's valued as opposed to what you have to say about things. So we make value judgments of a horse. There are lots of terms like field ornament or pasture pet versus happy hacker or maybe jumping machine. I think that these kinds of things can somewhat detract from us really being able to truly and honestly look at what is the horse able to do and what is this horse telling us, and what really is reasonable for us to expect them to be able to do, At the same time, I think that our domesticated horses being in our human world means that in order to serve them well, they do need to be prepared for the various scenarios that we might find ourselves in. And one of those is needing to carry out husbandry procedures or veterinary procedures which safeguard their health and welfare. So we do need some communication and some basic training that helps to prepare them for those situations. And I also think that exercise, including ridden, can be very healthy and beneficial for horses. And we can have an excellent relationship with them with communication where it is healthy for them to, in quotation marks, because I'm not keen on this phrase, do a job. However, it is a tall order for horses to have a weight on their back and to be obedient all of the time. There is a lot about domesticated horses' lifestyles and the requirements of carrying weight on their back that means that they might have pain somewhere. It is not unreasonable to expect that. It might not be pathology per se, or it might be. It might not be, in quotation marks, career ending. It could be transient. And it might not be treatable by one sort of narrow type of treatment, for example, giving an injection somewhere into the body and then going back to exactly what it was you were doing before. It might be that that specific treatment is needed, but that something else is needed as well, and that is changing some habits to avoid them re-injuring or just not recovering in the first place because they are habitually moving poorly or they have some underlying unmet lifestyle need and stress. So, where does this leave us in terms of have we really ruled out pain? There may be pain there or discomfort. There might be a type of discomfort which is not pain. So, it might be fear or confusion, lack of understanding. So, is it a training thing or is it a physical thing? In my experience, those things are really meshed together. I think that doing a veterinary workup with diagnostic tests is very valuable, and when we find things, that means that we can treat them specifically. I also think that there are quite a few drawbacks to only relying on a so-called lameness workup because quite a lot of the time, the horses that are showing behavioural signs, like, for example, bucking under saddle, there might not be a lameness that is seen when they have this investigation. And that can sometimes leave vets at a bit of a loss as to where to start because it's time consuming and expensive, and it can be invasive to test every single part of their body. And it's not very easy to interpret the results because you can find it difficult to attribute significance to the results if you don't have some body regions that you are suspicious about being the source of the problem. This is where my attuned assessment approach to examining horses and letting them tell you where they're uncomfortable comes into play. So I feel that this is really, really, really helpful alongside other diagnostic workups for trying to narrow down, zero in on the body regions that might be responsible for the behavioural signs. And I use a distance observation method and I also use a hands-on method where I really closely watch for their subtle responses. And sometimes they might not be subtle. Sometimes they're really, really clear where they're painful. But if they're not very clear where they're painful, or they give signs in all sorts of different locations, then this is really helpful for trying to pinpoint a region of the body that is likely to be involved in the signs. And then once you've done that the first time, you can use it as a follow-up evaluation for how your management or your treatment might be going. And you can refer back from your diagnostic tests to your individual patient as to the significance of findings. So I feel it's really important to treat the being in front of you and not just your diagnostic test results. My approach to answering the question of have we really ruled out pain is to first of all ensure that their species appropriate lifestyle needs are being met. And this is truly, so you have to be honest about this. be honest with yourself about it. Sometimes that's quite difficult to do because changing their lifestyle in order to fully meet their species appropriate means might be quite difficult to achieve, and it might be quite inconvenient. And I understand that in some cases people are truly restricted by where they can keep their horse and rules in boarding facilities and things like that. But just make sure that it is that you are seeking to serve the horse as opposed to looking at convenience or cost, if that is possible to do. The second part of the approach is to listen to what your horse has to say about how different things make them feel, and this is where my approach called attuned assessment comes in. That means that you can then correlate the significance of diagnostic test results to the signs that they are showing, because they are being genuine about things. They just behave the way they feel. Diagnostic test results are part of the picture, but then it's important that we treat the individual being in front of us and the ever-changing individual being in front of us, rather than test results in isolation. And in listening to what your horse has to say about how things make them feel, that is used to evaluate progress, and that is ongoing and lifelong, and things vary day to day, and progress is not usually linear. So you might have some improvement one day, and especially for things like muscular twinges, then you might be a bit sore for a few days after that, even if there's an improvement happening. And it's important to continue to listen to what your horse has to say about this. So in answering this question of have we really ruled out pain, what I would say is that we can't really ever say with certainty that we've ruled out pain, unless their behaviour suggests that there is no pain or discomfort there. I think it's as simple as that, really. It's an ongoing process, so it's a commitment that we make to the horse to continue to ask, are they comfortable and happy with what's going on in this moment? There is a lot that needs to be in place for horses to be comfortable and non-painful with bearing a rider on their back, and especially for certain activities. If you are trying to answer the question, have we really ruled out pain, as a reason for behaviour, or just want to know how your horse feels and communicates that to you, I am running an online workshop on my approach called Attuned Assessment. Sign up now for online access to the workshop materials, and the first of the 3 live Zoom calls is on the 6th of February. Sign up at www.nurturingnatureequine.co.uk/attune. Thanks for listening to the Vital Horse podcast, where you can find discussions focused on helping horses in ways that combine scientific principles and evidence with compassion and understanding. Do subscribe if this content has rung true for you. To work with me in a way that honours both head and heart, check out my online and in-person offerings at www.nurturingnatureequine.co.uk. If you are facing problems or are trying to answer questions with your horse, remember that physical, mental and emotional well-being are inextricably interconnected, that there is a wisdom to nature and to the body that we can assist, and that cultivating meaningful relationships with our animal companions holds an important key to the well-being of all of us. Deep awareness and a compassionate process will enable us to find sustainable, ethical solutions. See you for the next episode and look forward to working with you too.